right, with that said, let me introduce my very first guest this hour. Her name is Dr. Hellen Nguchu, and she's a cardiologist. And today we want to talk about health risks of abdominal fat. So welcome to the show, Dr. Good to have you here. Now, basically, the question of the hour is, what does your waistline say about your health? We're going to be discussing belly fat, the danger it poses, and what to do about it. Now, Dr. there's this term middle age spread, right? And it can sound kind of a little outdated or old-fashioned, but the concern is still relevant today. As people go through their middle years, their proportion of fat to the body tends to increase, more so in women and in men than in men. And more so you begin to see that really develop around their abdominal area. So just to start off, maybe you can talk to us about what really is behind belly fat.
The thing about first of all, when you talk about the middle age spread, I think now it's a misnomer in the sense that we're seeing it more and more actually in a younger group.
Wow.
There is a one that is naturally due to how your metabolism changes as you grow older. So you find that it slows down and you tend to accumulate fat, and usually the easiest place to accumulate it is actually around the belly, which is why in older people you will find it. That's true. But that does not necessarily mean that it's something that will happen only as you approach middle age. We are seeing it increasingly amongst younger people, and that one is primarily driven by diet and lifestyle.
Okay.
Yes.
Okay. Diet and lifestyle. So specifically, we're talking about these processed foods. Alcohol, I'm sure, has a big part. I mean, we joke around about kitambis, Maze, but it's a big contributing factor, isn't it?
Yes,
that alcohol is. Okay. So everybody has a measure of fat in their body, right? And it's okay. So how do you know that you have too much?
We have standards. There's something called the waist circumference. Basically, you take a tape measure and measure around your belly at the level of the umbilicus, that's a belly button.
Okay.
And usually measure it, most people want to measure it when they've taken in a breath and holding up.
Yeah.
But you have to actually exhale, so take a breath out and measure at that particular point.
Okay.
They have standards which we say 94 centimeters for men, 80 centimeters for women, but those are actually arbitrary because in Africa particularly, we don't have sufficient data to say that those are the measurements we should have. I think the best idea I can give patients is your waist circumference should at least be less than half your height.
Okay.
So if you measure yourself and you're 180 centimeters, kindly, your waist circumference should be around 90 or less.
90 or less. Okay.
Yeah. But in countries in Europe and in America where they've actually done population studies, they're able to actually give standards.
Okay.
So in the US, they say, for example, for men, 102 centimeters for men, 88 centimeters for women. If you're above that, you're definitely obese.
Okay. Yeah. And are there different types of belly fat?
We call it all belly fat.
Okay.
But there is a one that's just below the skin, and then there's a one that actually is inside around the organs.
Yeah.
But you see, the one below the skin only tends to accumulate after you've already filled up the one that's around your organs. So by the time you find that huge kitambi, trust me, the person's abdominal obesity, the central obesity, is actually quite
So
high.
that one that's inside, is that the one that they call visceral fat?
Yes.
And that's really dangerous because it's fat surrounding like your heart,
It's mainly surrounding basically most of your organs.
Okay.
And the danger with that one is that it's actually an active metabolic organ. So it's producing chemicals, it's producing hormones that have an effect on pretty much every aspect of your physiology.
Right.
Yes.
Okay. I once did a medical check, and they said that my visceral fat was okay. So it means that there are people who, but as you're saying, if your visceral fat is not okay, it's very likely that it also is very visible around you because you're saying that it is the fat that is inside, around your organs.
Yeah, that's why I'm saying the simple tool is just a tape measure. If you measure your waist circumference and it's elevated, definitely your visceral fat is also increased.
Okay.
Yes.
So here we are, and you're basically debunking that belly fat is not necessarily now related to age anymore. What sort of age groups are you seeing? Like, how young are we talking about now? When we find obese children, do you have, like, does that also immediately, if you find someone who's obese or overweight, does that immediately imply to you that their visceral fat is at significant levels?
Yes, those are people whom you want to now look for risk factors for heart disease, for high blood pressure, for diabetes, for cancer.
Okay.
Yes.
Wow. So a lot of the times when people then say that they want to start working out, and later on we're going to be talking about fitness on the show, but you know, we'll find guys like sitting down and just doing crunches, trying to get that six pack. I suppose that's not the way to address it, though.
There's no way you can't. I know people have this myth that you can lose weight in selected places.
Yeah.
No. If you want to lose weight, it has to be a full body workout.
Yeah.
Yes.
Speaking of alcohol, again, Nairobi, Kenya, it just seems to be such a party culture nowadays, right? Party after party. And so drinking then has become quite a significant vice, I would say, especially among young people. And so then for those who say that they still work out and that they're healthy and they try to watch what they eat, but they'll really enjoy their drinks, you know, do you have any sort of cautions for them?
I always say this, before the age of 30, you're the one running after the disease. After age of 40, it's 40. After 40, the diseases come running for you. Now, if you're much younger, you can take however much amount of alcohol and say, I still work out. You have the benefit of metabolism and youth on your side, so you can actually burn up those calories. But with time, your metabolism will slow down, and there's nothing much you can do about that.
Yeah.
It's an age-related factor. And so the consequences of all your actions are going to come through. Yes.
Someone here is asking, besides food, can belly fat be a genetic factor? Are more people, are some people more predisposed to having belly fat because of genes in any way?
There are what we call cultural differences. So there are certain cultures where they tend to be much larger than other cultures. So I can use an example. The Asians tend to be rather small. So you won't see much of belly fat with them at a particular age, although obviously it increases with age compared to certain other cultures.
Okay.
However, there is a limit. There's only so far you can push the genetic factor.
Okay.
Yes.
And then someone else here is saying that this myth of men having utambis and being proud of it and even calling it my public opinion. Guy, do people actually call their kitambis at my public opinion? Oh gosh. Utambi is a health calamity waiting to happen for us men. And maybe I feel like specifically, since we have you here and you're a cardiologist, this is something you can particularly address. We're getting into Christmas. Kenyans are just like preparing themselves for the feasting that's going to happen.
Yes.
Manyamajoba, makuku, mawat, chapos, everything, right? And in many ways, even when you get married in our culture, like what do the aunties tell you after you come back? Why mbona janona, right? Like it's like a symbol of his manness and his, I guess, wealth or status if he gets bigger. And so there's a lot of cultural things that are tied behind that. There's like a socialization that has to be unlearned even as far as belly fat is concerned.
That's true.
Yeah.
Yes.
How do you as doctors address that though with your patients then in the office?
It's about doing everything with limitations. I mean, you only do so much on moderation. We don't tell you don't drink alcohol completely, but you limit how much you're taking. Usually we say about 2 beers per day, but it doesn't mean over the weekend. You haven't taken over the week, you're going to swallow your entire balance for the week.
Yeah.
No, limit it to whatever it is for that particular day. And that's for men. For women, we obviously limit it to 1.
Yeah.
Yeah, but it doesn't mean that if you're not drinking, start drinking. No, you can just stay off.
Okay, yeah, just stay off it altogether. Joy from Kasarani says, hey Joyce, loving the show. What about the mummy tummy after delivery? Can you lose it without necessarily working out the whole body? Well, probably not. No. But for women who've carried children and then there's, you know, the mom belly, is that also sort of related to the same sort of belly fat that we're talking about?
No, usually the one that they get is basically the muscles becoming lax. And that one, if they go to the gym and basically work out, you can actually tighten up those muscles. My main concern is actually the fat part, not the looseness of the abdominal wall per se. That one will come with pregnancy. Yeah. But they still have to work out the full body.
Okay.
Yeah.
And I guess then, as we're talking about this, because you're saying we can't spot reduce anything, so it really boils down, especially, I mean, exercise obviously is very important, but especially it boils down to diet. And maybe once again, we can just go over, like, you know, the top tips as far as diet in terms of trying to avoid accumulating that belly fat.
The main things is, one, take a low carbohydrate, high protein diet. And when we're talking about protein, we're talking about plant protein, your legumes, you know, your seeds, your nuts. Have your bit of fish and chicken and meat. Have your dairy products. Reduce on sugar and sugar sweetened drinks. In fact, that in particular is actually what's driving our epidemic here amongst young people, is that you find that they want to take all these energy drinks and mixing various drinks and alcohol, and that's not healthy, because all that sugar is eventually going to be converted into that fat.
Wow.
Exercise, I cannot overemphasize, because the only way you gain weight is if you have an imbalance, so that you're taking in more than you're actually losing. So you actually need to increase your exercise levels. Yes.
And so even then with children, are there ways, how does a parent sort of navigate with the kid? You know, now it's Christmas, everybody wants chipos, they want all these fried foods. What suggestions would you have for parents?
No.
Just say no.
Just say no. I mean, I don't understand. If the child tells you that they want it and it's not healthy, don't give it to them. If your child demands a cigarette, are you going to give it to them? No, you won't. So avoid those sugar sweetened drinks. Educate your relatives, so that when you're going for a function, choose healthier ways of actually entertaining these children.
Right.
They're the sugar sweetened fruit juices. I don't advocate for those ones. Give them whole fruit. Yeah. If they want yogurt, basically take the yogurt, mix it with a fruit. You know?
It's very interesting, the example you've pointed out about if your child wants a cigarette, you're not going to give them a cigarette.
Yes.
Yet here we know that these processed foods are bad. But I guess because of the convenience of it, we're so quick to... But it's a very interesting point that we actually know these things are bad, but we almost very easily hand them over to our children.
Yeah. I mean, to me, sugar is just as bad as a cigarette, really. Don't give it to the child.
Yeah. Because even the proportion of kids walking around who are overweight is quite alarming, actually, especially here in Nairobi. I don't know if you guys have seen, you know, just even at the supermarket. And then you look at what the kid is eating and you're like, huh?
Thank you.
It's not even helping the situation.
Exactly.
So certainly something needs to be done over there. But thank you guys for your feedback on this discussion here today. Hopefully you've learned a thing or two about belly fat, okay? Understanding that there's the one that is really deep inside your organs. But even for it to show outside, whatever belly fat you have outside is really is a sign to you that your insides are not doing okay. And so we need to really unlearn this whole thing about utambi and celebrating the utambi, and just understand, even when a man gets married and he doesn't gain weight, clap for him. At least he's taking care of himself.
Thank you. And we need to inform people, when you go for liposuction, it doesn't sort out your visceral fat. It doesn't. Because all we're doing is basically removing whatever is on the surface. Yes.
Are a lot of people trying that now?
I suppose we'll start seeing an increase. I mean, we're seeing people basically going for skin lightening, so I'm sure people are ready for liposuction. Yeah. So just need to tell them, it's not going to sort out your belly fat.
Right. It's not going to sort out your visceral fat. That's a very interesting point. Good point. So you can look good on the outside, but you're not healthy anyways.
Yes.
Yeah.
Exactly.
Because I've seen skinny people struggling with cholesterol issues.
Yeah.
Yeah, absolutely. All right, guys, we're going to take a short break right now. Thank you again, Dr. for your time. I've been talking to Dr. Hellen Nguchu, who's a cardiologist, and we've been talking about the health risks of abdominal fat. But